Ladies and gentlemen, thank you for standing by and welcome to the Bring Speech and Mobility to Allscripts Professional EHR conference call. At this time, all participants are in a listen-only mode. If you should require assistance during the call, please press star then 0. I would now like to turn the conference over to our host, Ms. Rhonda Bletchke. Please go ahead.
Thank you very much. Welcome to the call this afternoon, ladies and gentlemen. We have a pretty exciting demonstration and discussion today around how Dragon Medical One can help bring speech and mobility to your Allscripts Professional EHR. And at this time, we're going to have everybody be in listen-only mode. And if you would, please enter your questions into the Q&A session on the WebEx. We will be managing and monitoring those questions and answering them towards the end of the session. At this time, I'd like to introduce our speakers. And our speakers are Dr. Tai and Dr. Justin Hubbard. So Dr. Stephen Tai earned his medical degree from Louisiana State University School of Medicine in Shreveport in 1994 and is an internal medicine physician currently on staff at Heritage Medical Associates. In this time, he has received the Attending Physician of the Year Award for his support and education of the medical residents at St. Thomas Midtown, and he has also earned his Certified Physician Executive Certification in 2017. Dr. Tai is a user of both Allscripts Professional EHR and Dragon Medical One, and he will be helping us with the demonstration today. So thank you, Dr. Tai, for joining us this afternoon.
Thank you.
Dr. Justin Hubbard is a Director of Product Management with Nuance Healthcare and is a technologist at heart, the clinical background in informatics training. As a product manager, Dr. Hubbard practices medicine at a scale by creating innovative products that help physicians improve outcomes. He's been with Nuance for several years, and his passion has been helping physicians utilize voice recognition products as well as AI-driven products to help improve their documentation and workflow. Thank you, Dr. Hubbard. And at this time, I'd like to go ahead and turn it over to Dr. Hubbard to talk about Dragon Medical One and Allscripts Professional EHR.
Sure. So, Justin Hubbard, what I thought I would do is give you a little bit of background of why Dragon Medical One was produced to begin with. We try to set our minds around how physicians are practicing in the world today so that we can build products that they can better utilize and help their productivity day in, day out. What we started to classify is that clinicians are very much on the move. This is partly because 43% of their day is already spent on data entry. They're spending 4,000 clicks per day in their documentation. On average, about 7.2 million words documented in just 1 year. At the same time, as they're doing all this workflow within the EHR, they're doing 12,000 steps. They're using a mobile device to communicate patient data, and 89% of our CAOs that we're interacting with are saying that portability, mobility is a key to their organization. So 35% of doctors choose to dictate on a mobile device, and Nuance, we say that it is 3 times faster to use dictation than it is to type on a computer. And for every hour of dictation that you would have done, we believe you are saving now 2.5 hours saved. So with that mindset that physicians are on the move, generating a huge amount of content, and in this workflow mentality, Dragon Medical One we built this Dragon Medical One product to facilitate that type of lifestyle for physicians. So Dragon Medical One is a cloud-based product that streams your audio to the cloud, processes it, and then returns that text back to the computer that's in front of you. We do this through the Dragon Medical One desktop application, but because we are a cloud-based product, we have the opportunity to expand that voice profile outside of that Dragon Medical One client to other applications. So we do that through the Nuance Healthcare ID. This allows us to extend your voice profile to other products such as secure text messaging companies that want to use that same voice profile, that same speech recognition, but in other products. In addition, any cloud-based product worth its salt should be able to look at how physicians are utilizing the product to be able to give you trends and detailed usage metrics. So for every Dragon Medical One user, we can track how many minutes per month are they using the application, how many words are they documenting over the course of that month, are they using more advanced functionality such as auto text or step-by-step functionality. This allows you to really lock in on those physicians who need additional training, who are not using the full ROI of the Dragon product, and then potentially give them training to, again, better utilize the Dragon Medical One client. In addition to the Dragon Medical One core speech recognition, we have these other accessory applications that help drive additional efficiencies within your organization. So the first off is Dragon Medical Advisor. Dragon Medical Advisor looks at the text that's being created by the physician, either via voice or via typing, and gives recommendations on how to improve that. The first foray is into ICD-10 specificity. So if I mention diabetes mellitus type 2, but don't continue on to talk about insulin dependency or non-dependency, comorbidities or acute or non-acute exacerbations, then Dragon Medical Advisor will hint to the physician that there are additional opportunities to fill out a more robust clinical note. The second is the nuance, quality, and risk adjustment. So these are for ambulatory physicians who are looking to improve their HCC diagnosis. We can provide suspected and recapture opportunities, again, to drive better documentation and better ROI for our end users. And the last is PowerMic Mobile, which is our mobile application allows you to stream your voice to the cloud via your smartphone that's already probably in your pocket. So again, portability is very much what Dragon Medical One was built from the ground up to do. We are compatible with Allscripts Professional EHR and designed very much in simplicity in mind. We can download, install, and have a user up and running on Dragon Medical One very quickly. There's the very small profile in terms of the CPU and the RAM requirements because the majority of the processing is done in the cloud. Because it's in the cloud, we have this always available mindset. This is designed for speed, accuracy, and flexibility to dictate in any EHR and any Windows-based application. There's no voice profile training required. What you'll hear from Dr. Tai and for anyone else who uses Dragon Medical One, the ability to automatically detect accents, select a base profile, start to calibrate the microphone, and start to do optimization from within the first few seconds of a user creating a profile allows it out of the box to be highly accurate. Next point around easy install and maintain, we support a couple of different deployment models. The first is a click once, which is auto updating. For those facilities that may be remote or a little bit hands off, this allows you to auto update the client without having to hands-on that particular workstation. We have and we support multiple VDIs, Citrix, VMware, etc. And you can do this for virtual app deployment. We have an exclusive Allscripts relationship that offers that seamless delivery through the various EHR hosted environments. And obviously, we are a healthcare compliant organization. All speech data is communicated over 256-bit encryption channel with TLS protocols for end-to-end security. We are a high trust certified application, which ensures the highest level of quality and security for your end users. So with that, I'm going to hand it over to Dr. Tai to give a demo.
All right, I'm going to get ready to go here. So, is my screen being shown now?
It is not, Dr. Tai.
Not quite yet.
Okay.
Now we can see it. Thank you.
Okay, great. Good afternoon. I appreciate everyone spending time here. My name is Steve Tai. I'm a general internist in Nashville, Tennessee. I've been using Dragon products for about 15 years now. I've been using EHR for about 20 years. And I think the struggle that I think we all have as practicing physicians is just trying to do the documentation. And documentation has changed so much over the years, and it's been challenging in this point-and-click environment that sometimes EHRs obligate us to do. And I think all of us still like to put our thoughts on how we actually think in a very simple manner rather than point and click, and I find that Dragon and voice recognition allows that. Where I've been happy with Dragon Medical One is the ability for me to now dictate on multiple platforms. I use the product, I have a PC in my office, I use a Mac Air in my exam rooms, and when I travel, I actually use an iPad, and the ability to use the power of Nuance and Dragon voice recognition on multiple platforms has really been a positive here. Just a few little slides here is that on Dragon Medical One, you can see here there's a variety of different specialties you can use. I use internal medicine. The language process or the vocabulary is quite strong, and you can see that various specialties are supported here. I do use what's called a power mic on my PC. It's a very good microphone that also allows me the ability to use these buttons here to do shortcuts with dictation or navigating. The other thing I use when I don't have the ability of my microphone, I use the mobile app. This is how it looks like on my iPhone, and this allows me to dictate on any computer. I'm not tied to actually having to have a microphone, or in fact, again, even being able to dictate with on the iPad. So this, I just pulled up a schedule here, and I'm just going to show you some basic things, some examples of how I just do my day here. I'm going to pull a patient here, and I've already started a note just to kind of make things simple for us. And I'm just going to jump in and start dictating. The positive about Dragon Medical One and Allscripts Pro is the ability to be able to dictate within the window itself. So I'm just going to go ahead and jump right in and get started on this patient coming in for chest pain. Patient here for follow-up after recent hospitalization period. Patient presented to the hospital on May 31st with chest discomfort period. Patient rolled in for myocardial infarction period. Patient subsequently had cardiac catheterization period. And you can see how the dictation keeps up with me quite well. I'm not dictating at any really different speed here. Cardiac cath showed left main disease, circumflex disease, and LAD disease period. Patient was thought to be a candidate for CABG period. New paragraph, patient underwent CABG without immediate complications period. Postoperative echocardiogram with normal ejection fraction period. Of note, ER EKG didn't indicate a STEMI period. So you can see here I need to make a correction, so I'll correct that your. Select your, ER. I will have to joke I'm from the South, so sometimes that ER and your, I'll kind of have that R run together. So, new paragraph, pre-op labs, new paragraph, sodium 135, potassium 4.2, chloride 110, CO2 25, BUN 20, creatinine 1.2, period, white count 5.6, platelet count 150, new paragraph, total cholesterol 220, HDL 40, LDL 160, triglycerides 100, period. So you can see it's very accurate. I'm dictating within the dictation box, or excuse me, dictating within the window, and really dictating at normal speed on here. And that's what's nice. It does abbreviations. It does our labs. So this, I thought, was kind of representative here. One thing I do is I do what's some common phrases that we'll use if, say, a patient's coming in for hypothyroidism and they're essentially normal, history hypothyroid. And you can see I can pull in this statement here, and that's nice if you having these default statements if you know the patients are something consistent. I'm also going to show you some editing functions. New paragraph, patient comes in for follow-up of hyperthyroidism. Scratch that. Patient comes in for follow-up of hypothyroidism. So you can see where I can make that easy dictation here. Insert after dry skin, cold intolerance, So again, I can dictate within the Allscripts box, and the ability to not have to use the mouse, or it's nice to be able to move the cursor or insert where I need to. So the other thing is I can select a phrase, select denies any symptoms, reports multiple symptoms of. So you have that ability to make those edits here. One other function I'm going to show you is something where we have auto text or macros that you can put in variables, and these can be user dependent, or it's very easy for a user to select these things. And you can, so I'll show this here. I have a patient coming in for hyperlipidemia, history of hyperlipidemia. And you see these things in brackets are things that I can actually, what are called variable text, or things that I can modify. So I will just going to dictate, and I can push a button on my microphone that you can see puts me through various fields here. Crestor 10 milligram daily, 6/11/2018, 200, 150, 40, 150. So it's a nice way to be able to, on a user level, make these in a very simple manner on here. One other thing I like to use is with patient messaging. I'm going to go in my manager. It's not our typical way to do messages, but just because of, this is actually my live database, so I have my patient messages from today. But say, for instance, a patient's calling with a question, and I want to respond back. I'll respond back to my staff. So my staff has sent me a note that the patient's calling with muscle discomfort and started on Lipitor and asking for advice, so I'm going to respond back. Please call patient - please advise them to stop the Lipitor, period. Recheck CMP, CPK, and lipid profile in 2 weeks, period. Make sure they don't have significant muscle ache or darkened urine, period. And I can send that back. So it's a nice way to respond back to your staff on here. So one other thing I can have is, say we want to send a message to the patient about their lab results. Message lipid. So again, here we're telling my staff to call the patient. Again, we have these variable texts here, and if I don't want to make any changes, or if I'll make a few changes, slightly above. And then the other items in text I want to leave alone, accept defaults, and it automatically puts that in the note there. So it's a nice way to take a few little shortcuts. We kind of have to take every kind of shortcut that we can take here. So again, in my assessment and plan here, reviewed issues with patient, period. They are doing well without angina at this time, period. We have them set up for cardiac rehabilitation, period. They will follow up with cardiology, period. Continue aspirin and beta blocker, period. Patient on a statin and doing well, new paragraph. Statin risks. So again, when I put a patient on a statin, it's nice to be able to put this one statement on here. So patient doing well with our hypothyroidism, period, no significant changes, period, continue, Synthroid 125 micrograms. So I gave you just a very brief presentation of how I'm using Dragon with Allscripts Pro. I do like the power of the recognition of the speech recognition, the accuracy. I also especially like the portability due to Citrix, or the portability on the Citrix platform and being able to dictate on multiple platforms. Again, Dragon works well. There's no voice training that has to be done for it to recognize the voice recognition, but taking training courses and doing the appropriate learning prior to getting or using the system, it will enhance your experience and make it work well for you. So with that in mind, I think we're going to a Q&A session on here.
Yeah. So I think one of the first questions that we had that came in, Dr. Tai, was what version of Allscripts Pro are you currently using, or did you demonstrate with?
I think we're on 17 right now. So
Okay, great. Another question that came in is, when is Dragon Medical One going to be compatible with Allscripts Pro version 17.3? Justin, do you want to take that one?
Yep. So we don't have a timeline yet for 17.3, but we're in active development efforts. We do think that there's a difference between support of the 64-bit version of Allscripts Pro 17.3 and the 32-bit version. We're just investigating which are currently supports that point of dictation, point of cursor dictation that Dr. Tai was already able to show you, and if there's any hiccups to the 64-bit version.
Thank you, Justin. Another question was from Paul. Do corrections have to be made on the front end in real time, or can staff access the note and make corrections after the visit? Justin, do you want to take that one as well? Or Dr. Tai, if you're familiar with that process?
In terms of editing, I mean, I edit real time. I've not actually had a staff use voice recognition to try to edit a note after the fact. So I don't have that kind of experience with that workflow on there. So.
Okay.
Right, and I think our anticipation is that most of those corrections would be made on the front end, and then if you were to have an alternative workflow where your staff look at it at a non-finalized note, that may be appropriate, but Dragon does not offer a recording and a text version of the note. That's part of the EHR.
And that's also part of the training that we provide to physicians when we enable them on Dragon Medical One, is just to help them have a good understanding of how to do those corrections, such as the one where Dr. Tai said select that, and he corrected the terms your to the proper word that he was speaking, which was ER. And there's other things that we'll train you on as well, as far as creating the short phrases that he had used to put in a couple of sentences of text, and also just to train specific words that may be unique based on either names that you want spelled correctly, locations, etc. So that's part of the training that comes with that as well. Another question that came in, and I'm just trying to keep up with these, is Allscripts, this is from Alvin, does Allscripts have to be installed locally, or can this run through RDP/terminal services? Justin, do you want to take that one?
No, this should be able to be run through those RDP or terminal services. We'll have to follow up with a technical response, but we have customers who have Allscripts deployed in an array of deployment models. For your particular one, we'd probably have to dig a little bit deeper just to double check that there's no limitations.
And by the way, if these answers are not answering your question, please just go ahead and mark that into the Q&A, and we'll get back to you on the additional details. Another question was, is this a cloud-hosted environment that you're working on? And just to be clear, I think there's a question around if Allscripts was cloud or Dragon Medical One, so if you could clarify that part.
So go ahead, Dr. Tai.
I'm part of a 140-person group, so we run, Dragon within our organization. We run Allscripts within our organization. So.
Mm-hmm. And so, in Dragon Medical One is a cloud-hosted solution. That Dragon Medical One being the product from Nuance, that is the connection, and we are the owner of the product. I think that answers two folks' questions on confirming if Dragon One is the dictation system, Nuance is the connection, because Nuance is actually the owner of Dragon Medical One, maker and producer of. Another question was, Dr. Tai, for you, did you use the phone app or the microphone? So I think you were talking about the PowerMic Mobile, which is the phone application, or PowerMic, which is the handheld mic.
That's a great question. So I use several different ways. I use a PC with the PowerMic in my own personal office. If I'm in the exam room and I'm using my Mac, I use the PowerMic Mobile. When I'm at home, I go upstairs and I use my PC and I have a PowerMic at home. When my wife lets me, I use her Mac in her office and I use my PowerMic Mobile. So I use it in a variety of different ways. This weekend I was actually, I was home in my hometown, New Orleans, and unfortunately, we all have work that we've got to do when we go out of town. And I personally travel with my iPad because it's just easier, and it's just nice. I have a Citrix mouse, and now with the PowerMic Mobile and getting into Citrix, I'm able to dictate using the PowerMic mobile app and my iPad outside the office. So like I said, all three, and it's very fluid from one device to the next.
Okay. Thank you, Dr. Tai. Another question, what happens, actually, let me skip to this one because I think it's similar to the one that you just answered. Can you describe a workflow where you wanted to note a patient chart in which you only had your iPhone Pro EHR app was not active? Is this possible? So it sounds like if Dragon Medical One is that the Pro EHR app is not available. The answer to that would be that you could dictate using Dragon Medical One, however, it would not be attached to the Pro EHR if your app is not active, so it would not go anywhere because there is no recorded version of Dragon Medical One that could be transcribed later. You could place it into a Microsoft Word application or something like that, but it would not be actually in your app if you're just dictating into your phone using the PowerMic Mobile. There's a question, Justin, you may want to answer this one. What happens in the cloud is not available? Is there a portable version that could go along on a phone or some other form of backup?
Sure. So we run Azure data centers. We have multiple data centers at this point, 2 today, but a third one coming along shortly. We run those in an active, 100% capacity possible configuration. And for those people who are not technically inclined, what that means is that if one data center were to go down, 100% of all the users could roll over to that other data center near instantaneously so that there's not any disruption to the dictation speech recognition. We have had an instance where a data center started to slow down momentarily, and we rolled over capacity to that secondary data center. With the third data center, we continue to believe that downtime will be at a minimal, and we can share with clients our current uptime. But there, to answer your question specifically, there is currently not a offline version or a portable version. We do have some thoughts in mind of how we might do that for our end customers, but we don't have it as a product today.
Okay. Thank you, Justin. Okay, so trying to make sure I didn't skip any here. Lots of good questions, so thank you all for answering, for engaging. Do we need to have our PC or iPad, et cetera, in front of us while dictating to any of the devices?
If you're dictating, basically what I liken Dragon to is if you had your keyboard. So if you're wanting to input data into your EHR, you need to have your EHR app open and running, so you can see what you're typing into. It's really, in some respects, it's no different than a keyboard or a mouse. So I'm hoping that answers the question there. So.
Okay. Another question that came in was, Dr. Tai, as well as those of us that have worked with Nuance, I think, have you had any experience with users with heavy accents successfully use the product?
In my practice, we actually don't have physicians with heavy accents. I know of Dragon being used in the hospital with physicians of that, where I've not heard any problems. I've not test driven it with my 94-year-old Asian father yet, so that may be one of my to-dos. But I think I'll defer to the Nuance folks for further answers on that.
Justin, you want to take that one?
So we use deep neural networks and recurrent neural networks to allow us to flow over to the base profile. We do this in a manner that happens within the first few seconds of a person beginning to speak. We have not, I don't think we've had a single reported where a accent was too thick or too problematic to have speech recognition happen.
Yeah, and I can give you personal experience working with Dragon Medical Services for a long time, as well as at events. We have had people come from many different countries with very thick accents and English as their second language be able to come in and utilize Dragon Medical One very successfully. I myself have personally demoed that with folks from the Asian countries, as well as from the UK, from you're talking any of the European countries as well. And also I know Christy as well has spoken with or worked with clients, and she's on the phone from Australia, from the UAE grouping of countries as well. So there's quite a good group of countries that have, or accents that we would cover. And as Justin said, we have not had any issues currently with thick accents not being accepted. Is there any concern that we host our EHR on our own servers when Dragon is cloud-based?
No.
That's currently our setup in my organization. We've had no issues. So.
Okay. I'm just scanning through, again, making sure I don't miss any. We've got that one. Does this impact any use with the EM calculator? I'm not sure what the EM calculator might be, but our providers are choosing templates, diagnosis codes, and then running the EM calculator upon completion. Would this be the same process with Dragon, only having provider complete note with Dragon versus typing?
So that's an excellent question. So with the Allscripts E&M calculator, you recognize that I personally don't use it a lot on there, but the E&M calculators, that's actually that's a click-driven type application where Allscripts basically looks at where you've clicked to determine the coding on here. So if you're going to dictate a physical or dictate a review of systems, it will not be counted in the E&M calculator. That's where the strong point of this is actually dictating a good history, a good physical. You know, in the future, using natural language processing and being able to extract that data is out there, but currently I don't depend on the E&M calculator based on what I'm dictating. Now, one of my workflows is for internal medicine, my physical exams tend to be pretty standard. I have one kind of for like when they come in for an upper respiratory infection, another one coming in for a physical, and my review systems tends to be fairly standard. I personally point and click if I need to make any changes on the review systems, or since I don't depend on the E&M calculator, I'll do free text dictation.
Thank you, Dr. Tan. Another question is, can this work via Citrix or VMware desktops?
Yes to both.
So yes, we do have the flexibility to work with both of those environments and setups. This is a great feedback actually from one of the participants. Stephanie, thank you for sending this in. She said that we have had many providers with heavy accents that purposely try to throw DMO off, and they cannot. It picks up their vocabulary perfectly. So thank you for participating and helping us answer that question from your own personal experience, Stephanie. Okay, so there's a question about how does the mobile app work? The only thing I'm not sure on, Jessica, is if you're asking about the PowerMic mobile app or if you're asking about an Allscripts mobile EHR app. So if you could please clarify that question and send it in to the Q&A. Okay. Let me just scan through and make sure that we have the others covered. I think we've covered all of the questions except for just a few. So one of the questions that we had as well that came in, Dr. Chai, is can you explain the difference that you have seen using Dragon Medical One versus other versions of Dragon Medical you have used, what the difference is in either recognition or speed and proficiency? Can you give us an idea of the difference between the products and what you've seen?
Yeah, I think the positive that with Dragon Medical One has really been the portability of it, of carrying my, because usually when I've had medical, I've used Dragon from Dragon version 5 to Medical Practice Edition 2. Where I like Dragon Medical One is the ability to dictate on multiple platforms, because I used to keep a voice, we in my organization were not running Dragon Network Edition, so users would have to load a voice profile at home, load a voice profile at work. I couldn't use it on my Mac, and nor could I use it on the iPad. So I think the real positive that I've really liked about Medical One has been the portability. The recognition has been outstanding, and then the ability to dictate and navigate within an Allscripts note has been outstanding on there. It's been very, very good. So Dragon Medical One is the most recent product I have used and have been very pleased with it on there. When you get to the core, I just wanted to transcribe what I'm dictating, and it does that well. And the ability to navigate has always been very helpful. It has been extremely helpful. Navigate and edit within the Allscripts text box has been outstanding.
Thank you, Dr. Tai. And then one last question, Dr. Tai, if you had to sum up the impact that Dragon Medical has made in your life overall, so not only in your clinical, but your ability to finish your work in a timely manner, can you explain a little bit about how that has impacted you?
The ability to dictate what I think as a physician and not point and click, to do that well, accurate, succinctly, and timely. The nice thing is, you know, at the end of my day, I'm not going home pointing and clicking. And at the end of the day, when I look at a note, I'm proud of my note that it actually shows what I'm really thinking and not a bunch of words picking from a pick list. So in terms of professional satisfaction about being a physician is outstanding, and then the efficiency in terms of my patient notes, communicating with my staff has just been is immeasurable on there.
Awesome. And one last question came in just as you were answering that one. Dr. Tai, do you typically dictate in between each patient or while in the room? Just wondering if you say till the end of the day. So you kind of answered it a little bit, but can you give us a little bit more detail around how you utilize and when you utilize Dragon Medical during your day?
I do it both. For instance, I find that if I've got a complicated patient, one of the feedback I got from a patient about 5 to 6 years ago is that I kept looking at the computer. I think that's what all of us do. So one of the things I do for a complex patient or someone with a complicated history, I'll still take handwritten notes and then go back to my office and dictate those either at the end of the visit or if there's something complicated at the end of the day. So it just kind of depends. It kind of ebbs and flows with how my office is going on here. So, but typically when I see about 20 to 25 internal medicine patients a day, I'm done dictating or done with my documentation. By the end, I stay probably an extra hour just to tie up loose ends, and that's if I'm dictating throughout the day or documenting throughout the day on there. So,
Paul, I think that question was just answered as far as how many patients do the physicians see in a typical day. I think Dr. Tai just mentioned 20 to 25 patients in a day. And then there was one other that was, I believe, answered as well around how much dictation is done at the bedside. So that was also, I believe you answered it very well.
I think that also, just to kind of tie in, sometimes when things are complicated, or I am also trying to, when I put in my assessment plan the number of things I'm doing, I actually will, there's always this question whether you should dictate in front of a patient or not. I do think when patients actually hear what you're saying and hearing your thought process, they actually put value on what we're doing, and the patient realizes you're not just there writing a script or ordering a test, but there's actually the ability to document thought process has been very good. The other thing is, and I didn't address this before, is all of us have to get test approved. Sometimes the insurance company looks at our notes, and the nice thing is that I will, if I'm ordering a CT or MRI for maybe not the exact approved reason that it can be done, but if I can share that thought process in the note, I'm not having to get on the phone with an insurance company physician reviewer. They see that in my note. And that's a nice thing about it. It cuts down my, in other terms of improving my physician experience. I'm not having to do things on the tail end explaining myself because it's already well explained in my note on there.
That's a great point, Dr. Tai. Thank you. Any last questions that I missed or that people are currently sending in? We'll wait, give it a couple more minutes. Okay, and let me just scan through one last time. Okay. I think we have, oh, here's one. Do you believe that using this has decreased reporting analytics? So that using Dragon Medical One has decreased reporting analytics, and that would, Dr. Tai, I don't know if you have any experience with that? In other words, decreasing the amount of free text that you have in discrete data.
Not per se. I mean, where I'm using it in terms of history and assessment and plan, I don't. I mean, our analytics are based on kind of lab reporting. We do have some manual chart reviews, so it's not made any effect in terms of my practice or my colleagues. I mean, you know, sometimes the standard is, you know, I have colleagues who instead of point and click will type their notes. So that's where that data sometimes is getting lost because it's still free text, but it's free text being typed on there. I think the physicians I have experience with, the point and click just doesn't work, and it's just a challenge. Right now, that's one of the one ways of getting discrete data is that mouse click on there.
Okay. All right. If there's no other questions at this time, we'll go ahead and close out the call.